A lot of parents say that they want sex education to be age appropriate, but what they often mean is later, vaguer, and less detail. And honestly, after more than 30 years of working in sex education and sexual health, this is one of the biggest misunderstandings that I see. Because age appropriate doesn't mean watered down. It doesn't mean confusing, and it definitely doesn't mean waiting until puberty. It means giving honest information that matches what your child can actually use now. And stay with me because by the end of this video, I'm going to give you the really simple question I use to work out whether something's actually age appropriate or whether it is really just adult discomfort dressed up as caution. I think parents get stuck here because they're scared of saying too much. They don't want to get it wrong and they don't want to start a conversation that they can't finish. And they don't want to accidentally harm their child by talking. And look, I get it. I really do. I'm a parent myself, and I still remember being at the park with one of my kids loudly asking why another child had black skin. And awful split-second panic where your brain just sort of empties out and suddenly you're trying to say something thoughtful while being completely unprepared. And that's what happens with sex ed too. And when we panic as a parent, we're usually doing one of three things. We're shutting the conversation down, we're getting vague with what we say, or we say way too much all at once. And one thing that I've learned, both professionally and as a parent, because I've got two kids myself, is that kids, they don't need perfect answers. They just need an adult who's calm enough to stay in the conversation. And in a minute, I'm going to show you the difference between too much detail and useful detail, because that's the bit which makes this much easier. So first, let's get clear on what age appropriate is not. And it's not using softer words because the real words make adults uncomfortable. It's not giving half answers that leave kids more confused than they were before. And it's not waiting until there's already a problem. And it's also not based on what feels emotionally comfortable for the adult in that moment. And honestly, I think a lot of what parents call age appropriate is actually adult comfort appropriate. And might be a bit blunt, but I think that's true because kids, they don't need less truth. And this is where parents often get tangled up because they think the options are either say everything or say nothing. But that's not how this works, not at all. Too much detail is giving information a child cannot actually do anything with yet. Useful detail is giving information that actually helps them understand their body, a rule, a boundary, a change, or a safety issue. And that's the difference. So teaching a young child correct names for body parts is useful. Teaching them what private means is useful. Teaching that nobody should ask to see or touch their private parts except for health, hygiene, or care situations with a trusted adult helping is useful. Giving a whole lecture they did not ask for and cannot use yet, like contraception to an 8-year-old, that's probably not useful. And that's a bit that I really want you to get. Age appropriate, it's not about giving the smallest amount of information possible. It's about giving the most useful amount of information before a child needs it in a stressful moment. And in a second, I'll give you one of the clearest examples I see of what happens when parents wait too long. This is why early teaching about bodies, privacy, consent, and boundaries is protective. Kids, they can't use rules they've never been taught. They can't explain something clearly if they don't have the words, vocabulary. And they can't make sense of body changes, touch, privacy, or boundaries if adults keep acting like they're too young to know everything. And after decades of doing this work, I can tell you that this is one of the patterns that comes up over and over again. Parents think that waiting is safer, but often waiting just means the child gets the information after they need it, or they get it from somewhere else and get the wrong information. And look, that's the wrong way around. Puberty, it's not the starting line for sex ed. It's just one of the many stages inside sex ed. Classic example of this, especially with autistic kids, is when parents leave public and private too late. They don't teach it clearly enough when kids are younger. Then puberty hits and sexual feelings can feel intense and overwhelming, and masturbation can happen in places that aren't private. And adults often react like the child should have already known better. But if nobody taught them public and private in a clear, usable way before puberty, then that's not just some random child failure, some kid just masturbating in public because they feel like it. And this is where my lived experience and my professional experience really overlap. Neurodivergent kids often don't need less information. They just need clearer information, more concrete information, and more usable information, because vague rules like not here or be appropriate actually aren't very helpful. Like, what do you mean by be appropriate? And look, if that example's making you realise that you may have left a few things or convos a bit late, please don't panic, because the question from here is not, have I ruined it or have I screwed up? The question is, what can my child use now? And this is where you start. So here is the simplest question I use when I'm deciding whether something's age appropriate. Can my child use this information safely now? That's the question. Can they use it to name a body part? Can they use it to understand a rule or a situation? Can they use it to make sense of something happening in their body? And can they use it to tell me if something happens? Can they use it to stay safer, less confused, and less ashamed? And if the answer's yes, then it's probably age appropriate. That's the test. Not, does this make me feel uncomfortable? Not, would I have been told that as a child? Not, can I avoid this for another year? The question is, can my child use this information now? That's a question that makes this whole thing much simpler. And this matters for another reason. When parents can understand age appropriate this way, sex stops feeling like one massive high stakes talk. It becomes smaller, clearer, and much more doable. And that is what helps you become askable. Because askable parents, they're not parents who have one perfect script ready to go. They're parents who answer honestly in small pieces without making the whole thing feel weird, shamey, or enormous. And that is what keeps the door open. And honestly, after all these years of doing this work, that is one of the biggest shifts that I see happening in families, is when parents stop trying to get every word exactly right and they start focusing on being clear, calm, and available, kids are much more likely to keep coming back, and that is the real win. So, if you've been using age appropriate to mean later, softer, or less, I want you to rethink that. Age appropriate means honest information that your child can use now, one layer at a time before they need it in a crisis. And that is how you make sex ed easier for yourself and safer for your child.